Fevers are not a bad thing, right? Fever's not bad. Fever's good. Fever is your body fighting off the infection, raising your temperature to help your immune cells to get to where they are supposed to make your body less hospitable. So it's not the fever that's the issue. It's just what else is going on. And we definitely have discussions about this. And I talk about, again, the book Fever Phobia, because I think it's a big question, and it's really actually very helpful discussion for parents that I found in my office early on, because that really does decrease the visits when you stop to worry about fevers. We're trained with a newborn to be afraid of fevers, and I think that's the issue, because the discussion kind of stops there. If a newborn has a fever, that's a big deal in the first month or two, because they don't have a really well developed immune system yet. But once you get older, if you have a toddler, they're going to get fevers all the time. And if it's a regular fever, like 100, 103, but they're smiley and happy, that's their body fighting off the infection. That's not a bad thing. And do you need antibiotics? No, most of the time you don't need antibiotics. Sometimes there's a bacterial infection where you need antibiotics for, like a strep throat or a bacterial ear infection or a bacterial pink eye. But most of what our kids are getting sick from are viruses. 90% or more are viruses. So the vast majority of the time when they get sick, there is no medication that they need. It's really just supporting their body and helping them to rest and get fluids and get a little extra sleep, and just giving the body what it needs to recover. And yeah, we don't want to give too many antibiotics, because any antibiotics are killing bacteria. So it's killing the good and the bad bacteria. If you need it, you need it. But if we're giving it just because, then it's affecting your gut, which is its own ecosystem, and that can have downstream effects. And we're just really starting to learn about all of these things. I mean, I'm an integrated pediatrician. I really try to focus on prevention and wellness, and thinking about things, root cause, thinking through the root cause, and thinking through what are the complications that might come from something like antibiotics. And it is important to think about, because a lot of us, as we were growing up, just took antibiotics like it was candy. We didn't really think about it. You had some ear pain, you took an antibiotic. And the research shows very clearly that the more antibiotics you have, the higher your risk of chronic conditions. Even one course of antibiotics in the first 6 months increases your risk for allergies and eczema and autoimmune conditions. And so that doesn't mean you should take it if you need it, but it does potentially have an effect. And so we should just use it when we need it. And I think that is true of all medicine, right? All medications potentially have side effects, and there's nothing wrong with taking a medicine if you need it, but it should be our last resort. It should be taken when we need to, because there's a cost to everything, right? And if you're taking a medicine, that's going to have some potential side effects.
I think that's so helpful for us to remember that, yeah, these effects of antibiotics and that fever is a helpful response for the body. People get maybe antibiotic phobic, or they get medicine phobic, Western
Mm-hmm.
medicine phobic, right? And distrustful of some of those things. For the people who are maybe much more into like natural kind of crunchy parents and don't want to give their kids any medicines, what are the medicines maybe that you would encourage those parents to maybe not be so afraid of, and to be a little bit more accepting of for when their kids need?
Yeah, great question. So I guess to go back a little bit, so for me, I did all the regular Western training. I trained at a great Western program, Jones Hospital, Los Angeles, and I personally just got a little bit frustrated with the regular system, and so that's what led me to start learning about integrative medicine. I'm not against Western medicine at all. I think that there is a time and a place, and we have created a lot of amazing medications that can save your life, and things that you would have died from just a couple of decades ago, you can be, back and healthy in a couple of days. But I also have seen that chronic disease rates are skyrocketing. We're not focused on prevention. We're spending 2-3 minutes with a patient. We're giving out antibiotics like candy, and that to me also was very frustrating. And so it took me to start, and also meeting my wife. My wife is also holistic minded, and so that kind of opened up my eyes a little bit too. And so I'm not woo woo, but I started learning about natural medicine and supplements and herbs, and there are a lot of practices that are used all over the world. But just like you said, I think a balance is what's important. It's not Western medicine or Eastern medicine or natural medicine. I mean, we should be balancing the best of both worlds, and sometimes, yes, your child might need an antibiotic, sometimes your child might need a steroid. It depends on the situation, but like we said, it should be a last resort. It should be something that you need it for, that you should have a good reason to take it.